This is a PowerPoint presentation on and management plan by Tangi Harris. Nurses have the ability to bring changes in their organization. We are change agents. We need to choose a team that ends and mission. We know that changes first begins with, as your team members had with change, address their feelings and continue on. Choose a model and let that be the framework for which your employees will adapt to. Employees to take care of their residents and to house their residents. I often hear that our nursing home doesn't bring money into the health system. Out of his own mouth that our nursing home was not set up to make money. And there are many reasons why our nursing home does not make, or poor documentation, especially things like the long-term minimum data sets that the MDS nurse code for on assessments like for diseases such as COPD and diabetes and multiple sclerosis. We also have lost patient supply charges, and we have uncollected bill payments from families. So I thought, what could I do? So I want to work on our patient loss supply charges. So at each nursing station, we have a patient supply charge notebook. When they get supplies, they're supposed to put the charge stickers in the books. The patient account assistant comes by each month. She'll pick up those sheets and she will bill for those. Those sheets contain very few stickers. When I make round or stickers in the trash can, I see them in the room. So I know they are not using the charge notebooks like they're supposed to. I had an employee in the billing office go back 5 years at the billing for supplies to see how much money was made back then versus how much making now from our supply charges. And the patient account assistant reported to me that we are losing anywhere from $1 a month on our patient supply charges. So what I would like to do is using our documentation system to capture those lost charges. And I think it's justified because we're losing anywhere from $24,000 to $36,000 a year. Sometimes when we call NUR Medical to get supplies, we're wondering why our supplies has not come, paid for our previous bill on the supplies that we have ordered the month before, and that's because we do not have the money to pay for them. We spend $800 to $1,600 every month on supplies, and if those charge stickers in the books and we were able to bill for all the supplies that we have been using, then we will have money to continuously order supplies from month to month. That I'm looking for is to put a question into our documentation system, which is called Point Click Care. I want the question, have you used it? Should prompt the nurse or the CNA every 4 hours. Answer yes or no. Answer is yes. Then the code beside the item that has been utilized should be checked. The question has to be answered before you can continue to go on to the next patient, resident, or before you can log out of that. How am I going to do this? How is my team going to do this? I spoke with the representative at Point Click Care, and she said it was up to my team and myself. Either we could create a brand new field, or we can place a supply charges in a field that was already made. And we could get with NUR Medical. which is who we get our supplies from, and get them to apply as a partner and see if their computer system would integrate. No cost to us. NUR Medical would be paying for this because they would be we would be buying supplies. We'll be able to buy supplies from them because we would be making the money that we should be making from distributing our supplies and being able to keep up with the charges. The chief financial officer, we would be actually assisting him and helping him to investigate and correct the issues of lost revenue from the nursing home. The administrator, he will get the credit for the nursing home saving money and the benefit by receiving a dinner, or may start to have activities for them that they could enjoy. With the director of nursing and making her aware of the issue of lost supply charges. The team would be the 4 clinical nurse managers, and their jobs would be to do the teaching and to check documentation, change process. And the way that we would communicate this would be through the Lewin's change management model. Just picture an ice diagram, and as the ice is unfreezing, that is when I would see the need for a change to take place in the process of the patient supply charge collection, and I would tell the staff why, and I would also gather together the staff, the stakeholders, and explain to them why also. And has thawed out into water. That is when the change has taken place, and we are now beginning to utilize this change. We're transitioning, and the employees are unsure of themselves, so they are going to ask many questions at the becomes frozen again. The change is complete, but because we are utilizing this process, the process is complete. Continue to reinforce this information because now it is a part of our work culture, and we want this new process to be successful. Anytime that a project is started, and throughout the process of the project, you have some difficulty anywhere during along the road. You form a risk mitigation plan. So I'm going to accept the risk that NUR Medical will say no to partnering with us. So I would just partner with the hospital of Granville Health System, from them that maybe we can continue to get all our supplies from them. And because NUR Medical, maybe their computer system will not integrate with ours, hopefully the hospital computers, and know that because we're a part of the health system, that we're going to take that risk and cost. So we're going to want to stay within the budget that we allowed. And because this include a computer program, numbers for technical support handy, and we're also going to want to keep the phone number of our partners handy, and we're going to ensure that the staff has access to those numbers, have access to all the closures numbers, so whoever that they will be able to call them if they have any questions or hardships. So as you can see, that residents for supplies, it will save us a lot of money. So, and change does not always occur as smoothly as we mitigation plans to fall back. We can avoid the risk. We can attempt to control the risk. We can transfer the risk, and we can watch and monitor the risk. But it becomes part of our work culture. The project team continues to monitor all documentation for completion, and which is myself, I am going to continue to check with billing on any changes in the revenue collected. And I want to thank you for your attention.